All right, so this is dry needling for the temporomandibular joint, and specifically, this is for the muscles of mastication as well as the joint capsule. So I got Keaton here, and he's in the position I want him to be. He's in side lying, and the first thing we're gonna do is we're gonna target these pterygoids. What I'm gonna do is see if I can get into both heads, the superior and the inferior head of the lateral pterygoid as well as the medial pterygoid. So while you're in this position, what I'm gonna need to do is get to that mandibular notch, which is just this sort of narrow tunnel here. So all I want you to do, Keaton, is you'll keep your lips together. I want you to lightly rest your tongue in the roof of your mouth and keep a little space in between your teeth, okay? And so I gotta kind of find this and take my time to find that notch, which is just below the zygomatic arch. And there's really 3 angulations I'm gonna do for this. And this is a 50mm needle here. And so what I'm going to do is I'm just going to go straight down into that. So this will be lateral to medial. And I'm gonna go until I hit bone. Just made it there. So that's pretty deep, right? I took the whole needle. I'm gonna actually grab a 60 for the rest of them. So that would put me, in theory, on the inferior head of the lateral pterygoid. But for most people that come in, they are gonna have a disc displacement with reduction. So what that means is when they open their jaw, they're gonna have a click, and then when they close, they're gonna have another click. So what I really usually try to do is make sure that I get the superior head of the lateral pterygoid with everyone that comes in for that issue, because it attaches directly to that disc. And so the thought process is that if it's yanking on that disc, that if I can get some type of relaxation, I'm therefore gonna get some type of change with that. And usually it works. So I've already got my first needle there. I can use that as a marker. So aiming for the superior head, what I'm gonna do is make sure I get into that hole, but I'm gonna angle this about 45 degrees anterior and superior. And this is a 60 this go around. And we're just gonna keep going. And you'll know pretty quickly if you're not there, because you'll hit bone about 10-15mm through the skin, and you're just gonna hit that zygomatic arch or the ramus of the jaw. But we're there. Again, we used about all 60mm of that needle. And then if I wanted to target the medial pterygoid, I'm gonna use my same insertion point, and now I'm gonna angle it about 45 degrees medial and inferior. So we're gonna go right down into that. And we went 3 for 3 there. So those are the ones I typically start with. The rest of it is all just kind of right there, easy to hit. So if we want to go for the Masseter, this one's kind of like search and destroy. So we're just going to go along, find some trigger points right along the ramus of the jaw, and we can go kind of right into that taut band of muscle tissue. This is a 30mm needle here, and I'm just going to go right down till I hit bone. We can do a little bit of needle manipulation on that if we want to. And then if I want to hit the temporalis, really the big thing here is big muscle here, really easy to find, but you want to take the time to palpate the superficial temporal artery. And it's because you want to avoid it, obviously. End of the day, it's not a big deal if you hit it, right? Because that's a branch of the external carotid artery. So all it does is supplies blood to the skull. But if you hit it, it's going to make the patient bleed. It's going to leave a bruise. So I feel his right here. So that just lets me know that that's not where I want to go. So just for demonstration purposes, I'm going to go right into this deepest part of the temporal fossa, just so you can see how far that needle can go here. And again, this is another 30mm. And we're going right down till we hit bone. I would probably realistically do at least 2 on the Masseter, at least 2 on the Temporalis. And then there's that saying in business, undersell and over deliver. So we're also gonna hit the joint capsule as well too, if it just determined that we needed to do that. So for that really easy spot to hit, I'm gonna find his mandibular condyle. I'm gonna go just posterior to that where that retrodiscal space is, which is also gonna be the joint capsule. And I'm essentially gonna sandwich this needle, again, a 30mm, right in between his tragus and his mandibular condyle. And this is a spot where once I get there, I really like to get in there, do some periosteal pecking. Looks like he felt that a little bit. And that's because joint capsule's chock full of nerves and has a good blood supply and all that good stuff. And so I will probably put 2 needles into that. And that's, for the most part, essentially what I'm going to do for most of my TMJ patients. There's occasionally some times where we'll go into some facial muscles, may go into the digastrics, and maybe we'll do some things for the neck as well too, but this is pretty much bread and butter for that. Cool. Good.